Thank you very much. Our next guest, this is constituent service. We have a number of constituents of our next guest in the room. The next guest, believe it or not, has been my mayor, my governor, and my senator. I lived in Richmond when he was mayor of Richmond. I'm a resident and we work in Arlington, Virginia as my governor, and became senator. Our next guest, who has had an amazing career starting as a missionary, as a civil rights lawyer, a teacher before moving into public service. It's our honor to welcome to the Axios stage Senator Tim Kaine of the Commonwealth of Virginia.
Hey, Mike.
Mr. Senator, thank you so much for joining us.
Oh, I'm glad to have you.
Very kind of you. Thank you for joining us. What is the most exciting thing you're going to do over Christmas?
I have my summer vacation from December 26th to December 31. When you're in an election year, you get no summer vacation. But yesterday, Mitch McConnell gave a speech on the floor that said senators should be prepared to work from December 26th to December 31. So we'll see what I'm going to be doing exciting over Christmas.
What do you think is the real translate for our guests?
I think that was a little bit of what they used to call an Allen charge, that a judge would give a jury, like, hey, come to a decision. I think we'll likely wrap up sometime late next week, but we obviously have the big issue of border funding and the remaining appropriations bills that will be the complicator.
Senator Kaine, in 2 seconds, we're going to go to access to healthcare, but real quick, news of the day. You tweeted after yesterday's Chuck and Nancy festivities, you said, make no mistake, Donald Trump is cheerleading a shutdown. What do you see coming?
Well, I think he's got two bipartisan options on the table before him, and he ought to accept one. One is that there's a bipartisan deal in Congress to do between $1 billion and $1.6 billion for border security. We did $1.3 billion last year, and the administration couldn't spend it all. So that's a bipartisan deal that the appropriators have worked out. That would be a good deal for them. Or we could do a continuing resolution for 2 months and just spend what we've been spending as we work out the final deal. Both of those are bipartisan. Both of those are options on the table for him, and I think he'll accept one of them.
Senator Kaine, something that's very much on our theme today of access to health care. You've said health care is a right. How are we doing in America?
Better, but we're a long way from being able to really claim that we're doing everything we can. The uninsured rate is down from where it was 10 years ago, and families are protected against pre-existing conditions. Kids can stay on family policies. Women can't be charged more for premiums. So there's a whole series of positive things. But I just came off a campaign cycle where I was around Virginia all the time, and I heard what everybody else hears. We want more options. We want lower cost. Healthcare was the biggest issue on the trail in every corner of the state, whether I was talking to Democrat, Republican, or Independent. More options, lower cost. That's what we have to provide, I believe, as Congress working together with the administration.
Now, more options, something that you introduced last year that is one of your signatures, along with Senator Bennett of Colorado, Medicare X legislation that would create Medicare-style options for non-elderly workers. Tell us about the outlook for Medicare X.
Yeah, just real quickly, I think it's fairly self-explanatory. We just take the existing system and add one more element to it. And that element is a policy designed by CMS and offered on the exchange to individuals and the small market, beginning in geographic areas where there's only one insurance company writing policies. People can choose it if they want. If they qualify for financial assistance under the Affordable Care Act, they can apply that financial assistance to the Medicare X premium just as they would if they purchased private insurance. So it's taking the existing system and adding an element, but it is an additional option, and it would be lower cost since Medicare doesn't have to cover a profit margin, return to shareholders, pay fancy salaries, advertise on the evening news, pay state, local, federal taxes. It would be affordable. What are the chances? Senator Alexander, who was here earlier, he and Patty Murray have done a really good thing this year. They've had a whole series of hearings to kind of set up what are the challenges? What's the diagnosis of problems in our system? And the idea is, okay, next year we'll get into prescriptions. And there's other prescriptions on the table, too, from Republican proposals to Senator Sanders' proposal. But Senator Bennett and I really believe if we take seriously what we've heard over the last year, and if we take seriously what we've heard from people, we want more options, we want lower cost, then we think we've got the plan that is most likely to gather support. Maybe not immediately, but if we really get into problem-solving mode, we feel good about this proposal.
A read between the lines on Medicare X from Paul Kaine the Washington Post. He says it's politically significant because it builds on existing law rather than the tear it down approach being offered by Senator Bernie Sanders. As you listen to the 2020 conversation among Democrats, are you worried about how out there they're getting on health care, among other issues?
I'm not actually worried, and let me debunk something that I sometimes read. I read that the Dems are deeply divided on health care. The difference between the Dems is like this. The difference between the Dems and the Republicans is like that. Republicans are still attempting to repeal the Affordable Care Act, either by vote or administration sabotage. Democrats want to preserve the Affordable Care Act. We all voted to protect it. Democrats want to dramatically expand health care coverage. Are there different ideas for how to do it? Sure there are. But I think the differences between Dems are not that great. And I would say the same thing, Mike, about the campaign between Dems as I would say about our committee. Get the ideas on the table. Let's be the deliberative body that the Senate's supposed to be. Republican ideas, too. We're going to need them all on the table, and then we're going to need the stakeholders, insurers, hospitals, docs, the American Cancer Society, patients. We're going to need everybody looking at the big proposals and saying, well, we like this and we don't like that. And then we can find a path forward to the next big step forward that will increase options, reduce costs, and cover more people.
But there's definite risk for the National Democratic Party in an age of where the sort of Trump-type voters who are potentially accessible to you in those big Midwestern states to have Medicare for all be your brand.
There is some danger there, too, but there's also an opportunity for us. Why did Joe Manchin win in West Virginia? Donald Trump won West Virginia by 43 points. I think Joe Manchin won West Virginia, partly because people knew him, but also because he made the campaign about his opponent's effort to tank pre-existing conditions in the Affordable Care Act. And so, interestingly, a state that might be one of the most pro-Trump and anti-Obama states is also a state deeply loyal to Obamacare and expanding health care coverage. Why did Utah, Nebraska, and Idaho, by referendum, embrace Medicaid expansion, Obamacare? It's because there's a recognized need. So, there are some differences on the Democratic side, but again, I think the differences between Dems compared with the Republican orthodoxy now is so stark that the differences on the Dem side will seem minor by comparison.
Opioid addiction is an issue that really hits close to home in the state that you and I love and have lived in. You spent a lot of time in the coal fields and elsewhere. What is your sine wave of what's happening to opioid addiction in Virginia?
First, on Christmas reading list, if you haven't read Beth Macy, and you probably know Beth, reporter for the Roanoke Times.
Sure.
If you haven't read her book, Dope Sick, it's really a good read. Even if you've read Dreamland and other books about the opioid crisis, it's a great book, largely about opioids in Appalachia. But opioids are everywhere, as Secretary Azar said.
And give us the smart brevity on Beth's big point. And we promise we'll still read it.
Yeah, I would say first that Secretary Azar was right. This was a crisis that came out of the medicine cabinet and came out of people with white coats. In that way, it's very different than other drug crises we've had in our society. And so that's the tragedy of it. The book is probably more about moms than it is about anything. But that angle into the story, what mothers will do for their kids, is incredibly touching, incredibly vivid. And but it's her point is this is a disease that's no respecter of persons. If you look at the stats in our country, opioid overdoses, and you look at states 1 to 50, you'll see a list unlike any list you'll ever see when it comes to a measure of social pathology. And the reason is you'll see in the best 10 states, rich and poor states, and you'll see in the worst 10 states, rich and poor states. Mostly if you're looking at a list like that of some bad outcome, poor states are always hit the hardest and not rich states. But this is no respecter. The challenge right now, the arc of the problem is Secretary Azar was right, and I give them credit. I give Scott Gottlieb credit. We're doing some things that are reducing the amount of prescription-based opioids that are being provided, that are being prescribed. That's good. It's starting to come down. But fentanyl is coming in and starting to swamp all of that. And so when you have more people dying of addiction, of opioid overdoses, last year than died in the entire Vietnam War, we're losing a war to despair and despondency every year in this country, and there's got to be a sense of emergency about it. I would make that the moonshot, addiction-free by 2030. Francis Collins at NIH says we know enough about the science of addiction and what can cure it to be able to make that claim addiction-free by 2030 and actually do it. We know enough. Do we have the will?
What would it take? Say we had the will and wallet, which are both highly questionable, but if we had the will and wallet, how is it that we would do that by 2030?
It would be a combination of things. And I'll give Senator Alexander credit because work that we've done this year on addiction starts to get at it. It's going to be research, especially into non-opioid-based pain management strategies. And Scott Gottlieb at the FDA is fast-tracking in a really proactive way. Give him credit for this. Pain management techniques that are not opioid-based. That's great. It will be some law enforcement and interdiction to deal with the fentanyl problem, and it will be a significant increase in treatment availability. I was at a remarkable treatment program, Mike, in the Chesterfield County Jail. Carl Leonard, the sheriff there, just was tired of opioid deaths, and he wasn't trained and he didn't have the money, but he said, I got to do something about it. He started a really novel treatment program that's based on a recovery home model that many of you are familiar with. But when I went and visited the 70 men on one side of the jail and the 60 women on the other side that were in this program, on each side they said, Senator, why did I have to get arrested to get a program like this? And there's something that's kind of sad, true, challenging in a question like that. We've got to make more treatment available.
What is the biggest risk to the Affordable Care Act?
Well, look, I think the biggest risk right now is administration sabotage.
In what form would that take?
Well, it's taking place. It's taking place, and I want to give Secretary Azar credit. I think what they're doing right now, using Obamacare, using the experimental pilot project component of Obamacare to do what he's going to do on prescription drugs. Good on him. I think that's a very, very sharp idea, and we'll test it and see if it works. But things like shrinking enrollment periods, reducing navigators, assistance to those who want to enroll, getting rid of the individual mandate. President Trump at rallies during the campaign season said, I couldn't kill this by votes, but don't worry, I'm killing it anyway. He bragged about that. That was an applause line. That is the risk right now. But when you counter it with the voters of Idaho, Nebraska, Utah by referendum, with the Republican houses in Virginia expanding Medicaid last year. I think what you're seeing in the Affordable Care Act is what happened with the Civil Rights Acts in the 60s. LBJ said, we should do this. It's the right thing for the country. It may cost us politically in the South for a while, but we should still do it. The Democrats paid a price in 2010 for doing the Affordable Care Act, but now you have Republican states by referendum deciding they want to embrace Medicaid expansion. It was the right thing to do. We can't nick it and cut it to death, and we also do have to be willing to take new steps forward.
Senator Kaine, as we say goodbye, Chairman Alexander critiqued your harmonica expertise earlier. What is your next instrument?
Well, I'm trying, getting better on the harmonica, but that's a lifelong project. And I did play a lot of music on the campaign trail this year. I am beginning to teach myself to play the auto harp. I got a lot of free time in the Senate. So,
Merry Christmas. Thank you, Senator
Thanks,
Kaine. Thank you very much.